Hello, Arkansas, and welcome to this week's edition of Arkansas Money Talk, brought to you by the team of Retire Path Wealth. I'm your host, Kristen Oakley, and I'm joined by the president of Wealth Management, Dale Colclaser, and co-founder, Mark Smalling. We've got a great show for you today. The title of this episode is Navigating the Medicare Maze. We know that Medicare can be confusing and overwhelming, and a lot of the marketing out there can be misleading and really cause people some confusion. So we want to clear all that up today. We love helping folks navigate to and through retirement successfully in all areas, including this important Medicare conversation. Dale, Mark, so good to be here with both of you this week. How are you?
Doing great.
Always great to talk finance.
Yes, for sure. Well, one of the things I want to help our viewers understand, especially for folks who might be newer to you and to this show, this is really special and unique that you all do Medicare in-house as part of your financial planning process. Talk about how this really sets you apart in the financial planning space.
Well, the real deal with this is because there's so many things that that changes in your other areas of your finances can affect your Medicare outcomes and your premiums and your costs. The vast majority of, quote, financial planners you're going to go talk to, again, as we've talked before, they are asset managers, and that's really their focus. That's really all their firm does. And when you begin to ask questions about Medicare, about legacy planning, about taxes, they're going to get wait, that's not what we do. We're going to refer you out to somewhere else. We just simply really take the fiduciary standard, to heart.
Yes.
And to say, if we're helping you in one of these areas, we really should have a solid understanding of how it affects every other area as well. And Medicare is a huge one.
For sure. And so I'm really happy that you are providing the sound financial advice in all areas, but especially Medicare, because again, the marketing machine is so crazy. I always kind of joke that when folks turn 64, 65, you get really sexy, right? Because you're going to be inundated with all this information, but a lot of it's really misleading. And really, there's three things that people tend to care the most about when it comes to Medicare and enrolling in it. They want to know about the access to the health care they're going to receive, what benefits are going to be included with your plan, and what it's going to cost. So we're going to get into all of that today. But first, let's review the basics, Mark. Let's just go through, Medicare has several parts. We often call it the alphabet soup of Medicare, right? So let's break it down for our viewers and go through each part.
Right. So, this is kind of where we start when people first come in to talk about their Medicare planning is a lot of people don't even understand where to begin. So if we go back to the beginning of when Medicare was put together and there was just Part A, which is hospitalization coverage, that's what's free to most people, as long as you or your spouse have paid into the system for at least 40 quarters, that's free to you. If you haven't, for some reason, there's actually a premium that's associated with that, but most people don't pay that. Then there's Part B, which are medical services, outpatient services. So these are the doctor visits and things like that. And that has a premium, and the premium for 2025 is $185. It gets adjusted every year. If there's a cost of living adjustment on your Social Security benefit, you're going to see a rise in the cost of your Part B premiums. And you can pay more based on your income, and we're going to talk a little bit more about that later. And then about 20 years ago, they introduced Part C of Medicare, or Medicare Advantage plans, that were used to give people another option of how to receive their Medicare. They're plans that are actually, they're contracted by CMS with private insurance companies to manage your care for you. Oftentimes it includes a prescription drug coverage. And then Part D is the actual standalone prescription drug plans that came out the same time that Medicare Advantage plans. And they're also offered by private insurance companies. And they're all standardized by CMS. Everybody's got to offer it at least the same type of benefit, so you can kind of compare apples to apples and not and not get too much confusion about that. When you have Medicare Advantage plans, they're oftentimes offering benefits that you don't have under original Medicare. You can have benefits for dental and vision and health club memberships, and those things can be added in. There can be over-the-counter benefits. all these different things that are available.
Yeah. I mean, no wonder it's so confusing, right? Even those of us that work in this space, just going through the litany of like, okay, this covers this doesn't cover that. You need to understand the different parts. And I think that's another huge misconception out there is a lot of folks think that Medicare is going to cover all their healthcare needs, but that's not the case, right?
Well, not only that, they think it's going to be cheaper than what they have had in the past. And I think that's when people begin to realize that their employer-sponsored healthcare wasn't so bad in the first place. Because again, there are these preconceived concepts that the Medicare options are always going to be less expensive, which can be a great surprise, especially for those that have had very good earning years, that there's this surprise IRMA thing that pops up out of nowhere that they knew nothing about.
Right. Yep. So again, I think we have to help folks understand how to navigate through this, and it starts with the open enrollment period, right? So let's talk about that. When can folks review their Medicare plan choices and make changes to their existing coverage if need be?
So every year there's an open enrollment or annual enrollment that runs from October 15th to December 7th. And that's when people can make changes to either their Medicare Advantage plans, or if they have a prescription drug plan, a Part D plan, they can make changes during that time. And, so you start getting mail again, because you were talking about, about that. People get very popular. A good example of that is this was just a few weeks ago. We had a client that we'd enrolled in a Medicare Advantage plan. What we didn't talk about earlier, there's also Medicare supplements that are offered, or Medigap plans that you use along with original Medicare and your Part D. Well, she'd enrolled in a Medicare Advantage plan with a particular carrier. Well, the carrier started inundating her with information about their Medicare supplement plan. So she thought that she was supposed to do something else. She calls, he's like, well, I got this application to enroll in this Medicare supplement with such and such company. I said, I thought that we'd already taken care of all that. Well, we had. She was enrolled, but it's all this confusion because you keep getting all this stuff over and over again. So outside of the annual enrollment period where we can look at those things, there's also a Medicare open enrollment period that runs from January through March the following year. So in case you made a mistake or you found out that your doctor's no longer in your directory on the plan, because with Medicare Advantage plans, your doctors need to be in network. And if they're not, they may not accept the plan, or it may cost you more to go see them. So, oftentimes we see that if a hospital or doctors fall out of the network, that people make changes during that time period.
Right. And that's good to know, because I know life can change very easily. You might need different medications than you did, right? You might need more help. I mean, there's just a lot that needs to be updated and reviewed. So how often do you recommend that folks actually review their current Medicare coverage?
Well, at least annually. There was a study that Fidelity did that said a 65-year-old person for the rest of their life can expect to spend somewhere around $157,000 for the rest of their life. And then if you're married, that number is going to double. So we're talking about $300,000 worth of expenses that can occur. A lot of that comes from mistakes that are made because people do not review their options. We talk about this in the life insurance world as well. If you have a cash value policy, you should probably be getting a new in-force reprojection every year. Well, Medicare is very similar, especially if your formulary changes, or you've had a change in prescription, or your pharmacy's changed, especially if you've moved, because that may change everything.
Right. Yep. And if you're traveling, that needs to be taken into consideration. Talk about that, because I know some people have had some horror stories of traveling in retirement overseas, and all of a sudden their Medicare doesn't cover. Right.
Right. I mean, Medicare doesn't typically cover you when you're out of country. There are some plans that have a little bit of coverage. We always recommend, if you're going to be traveling abroad on a pretty regular basis or longer trips, get some travel coverage while you're going. It's not that expensive. But we also have people and clients that have homes where they spend time in different states. And so you want to make sure that you have a plan where you're going to be able to get your prescriptions while you're at your other home, and that you can get everything filled, and there's not going to be a problem with that.
Right.
Well, as Mark just alluded to, the other travel coverage, I always want to remind people every as well. We have in-house solutions for a lot of these things. So those are things we can assist with also.
Absolutely. Well, studies do show that less than 1/3 of Medicare enrollees take advantage of open enrollment in order to compare plans and reevaluate their coverage, but clearly it's important to do so. So what would you say to someone watching who is wanting help to navigate through the Medicare maze for themselves?
But what I would say is if you're coming up on the age 65, you're getting near that and you're having questions. If you're already enrolled in plans and your thought has been, gosh, it's worked great so far, that to give us a ring. Let us look at your options, look at where you're at today, the plans that you have in place. There may be better options available for you. Every year, as Mark said, during that open enrollment period, changes come, so we can have changes in coverage. So again, if you're nearing the age 65 or your spouse, or we're already into the system and you don't have someone that's actively servicing your healthcare needs, please give us a ring. Just call the phone, scan the QR code, let us get involved with you to make sure you're making the right choices.
Wonderful. Dale, Mark, thank you so much. To our viewers at home, that number to call is 866-724-3893. Or if you'd rather connect online, simply scan that QR code. That will take you over to a landing page, ask you a few short, simple questions, and then a member of the team from Retire Path Wealth will reach out to connect with you to schedule your time to come in and receive your complimentary written income plan. And as part of that, they'll be glad to help you navigate the Medicare maze for yourself. Stay with us. We've got more for you right after this.
I became a financial advisor through a referral from my financial advisor. I was leaving a career in the corporate world and basically was looking for something else to do. And he said, hey, don't you have a finance degree that maybe you can put to good use? I went to college, was supposed to be a dentist, and physics and organic chemistry changed that path. I think it was the realization of having worked somewhere long enough to know that I didn't want to have to work for someone else, that I was looking for more entrepreneurial career path, and the opportunity for financial planning offered that to where I could basically have my own practice at that time. I started one of the biggest financial planning firms out there. There was a lot of positives learned from there, but also learned a lot of things that didn't really line up with my sense of belief, and knew that there were others out there that probably felt exactly the same way. So even though I learned a lot about the industry, I also began to learn that a lot of financial advisors are taught the industry by the vendors and wholesalers themselves, and came to the understanding that a lot of what we consider to be general consensus advice is really based on those techniques that are benefiting those that are teaching, not necessarily those that are investing in those products.
Welcome back to Arkansas Money Talk. I'm Kristen Oakley here with Dale Cole-Clazier and Mark Smalling from Retire Path Wealth, and we're so glad you're joining us today. If you're just tuning in, today's show is all about navigating the Medicare maze. We know it can feel very confusing and very overwhelming, and yet again, this is something that really sets you and the Retire Path team apart, is that you engage in Medicare planning. You have in-house solutions for your clients, and I love this. We say this on the show a lot. How you make a decision in one area of your life can and will affect all the others, especially when it comes to financial and retirement planning. And Medicare is one of those pieces that if you don't get it right, you could have some negative consequences in other areas. And so this is why you take this so seriously. Also, I think we should highlight, you do a lot of webinars in the state of Arkansas for different companies. Talk about that specifically on this subject.
Yeah, it's interesting, Kristen, that the companies, the HR departments can't give people information about Medicare or what to do with it. We've got more and more people that are working past age 65 and they're becoming Medicare eligible. They don't know what to do. They don't know whether they should stay on their group health plan or if they should look to go to Medicare, or they have a spouse that's covered and they're aging in. So we get all these questions. So this is a huge part of what we do, is helping people navigate those situations and explain to them about how all these different plans work, whether they should enroll in Medicare Part A or Part B. If they're enrolled in a high deductible HSA plan at work, you're technically not supposed to have any other coverages, including Part A. So there are things that you can do that are detrimental because you can't make a contribution to an HSA account. Your employer can't make a contribution to your HSA account if you or your spouse have another health coverage. Then enrolling in Part B, we see it all the time where people have enrolled in Part B and paid these premiums while they also have group health coverage. So they're double paying for really unnecessarily in most cases. There's no reason to do it.
Right.
And we've got this alphabet soup, and we talked a little bit earlier about Medicare Advantage plans and Medicare supplements. Which one's right for you? Because we have spouses that come in and one ends up going with one type of coverage and one goes the other. Everybody's situation's different, and we believe as fiduciaries that we've got to help find the best plans for each person that we're talking to. And that's part of what we do.
Yeah, no, and I love that because it blows my mind. You all know that I've been fortunate to work with lots of different financial advisors across the country over my career. And a lot of guys that I work with, they don't talk about this stuff. And when I ask them why, they say, well, because there's no money in it. But all of us at this desk know that being a fiduciary means you have that legal and ethical obligation to always serve the client's best interest. You have to look at this. I mean, everyone needs Medicare, and it is so crucial to the health of your overall financial plan.
Oh, absolutely. And one of the reasons that it works so well in the webinar situation is because as a fiduciary in the employer system, they have the ability to talk about what their health plan will cover, but not what other options are. And again, we all know how frustrating it is to pick up a 1-800 number phone call and call somewhere, especially if our answer is, hey, we can get you an appointment in 11 to 13 weeks from now. And so one thing I'll encourage you out there is if you're someone who works in an HR department that has these questions that come up that you don't know how to answer them, or you don't have a resource to reach out to, or you work for an employer who really does love to get information to their employees, I would encourage you to reach out to us today, to give us a call, to scan that QR code. Let us know that you're either that HR professional that's trying to help your employees get a better understanding of how healthcare transitions work, so they can have an understanding of what are the things they do have to do at a certain age and what are the things they might need to do at a certain age. And then when they do leave, what all are the other steps that now have to be accomplished to help avoid what those penalties might be? Please reach out. Let us be a resource for you and help you understand how you can help your folks.
Wonderful. Dale, Mark, thank you so much. And I know we've got a lot more to get to, including the costs of Medicare when we come back and how you can minimize those Medicare premium surcharges. But again, we encourage you to reach out. This is a vital part of your overall retirement plan. And if you're already working with another financial professional and they are not having these kinds of conversations with you, you owe it to yourself, and it's time for you to get a second opinion. And the team of Retire Path Wealth would love to be able to provide that for you in the form of a complimentary written income plan where they can discuss Medicare and any other aspects of your financial life as well. 866-724-3893 is the number to call to claim yours. Or again, you're welcome to click that QR code and that will get you connected as well. We'll be back right after this.
I didn't start out in Medicare. Medicare is something that came along later in my career. I started with Northwestern Mutual as a college intern back in the early 90s. And I was with Northwestern Mutual as an advisor for about 12 years. And then I actually went out on my own after that. And it was actually when I joined another firm that needed somebody to get into Medicare because Medicare was going through a lot of changes. That's when I got into the Medicare business. And I became an intern at Northwestern Mutual through a college, job fair day. And that there was the advisor for Northwestern Mutual out of Little Rock. The district manager came over with his recruiting specialist, and that's how I ended up as an investment advisor at Northwestern Mutual. So that's how I got into the game. The thing that I enjoy most about my career is being able to help people on a daily basis. I mean, to literally see people come in the office that are scared and there's a lot of trepidation about what do I do and where do I go from here, and having them leave with that weight lifted off of their shoulders, making sure that everyone that comes in to our office leaves feeling like they've received something of value from us.
Well, welcome back to Arkansas Money Talk, where today we have been discussing navigating the Medicare maze. We know that this is a crucial part of having a comprehensive, holistic financial plan. The team of Retire Path Wealth takes Medicare planning very seriously as part of their in-house solutions for you. It's time now, guys, to talk about the cost, because I know you get a lot of questions about that. Again, there's a lot of confusion out there about how much Medicare will cost someone. So kick us off, Mark. Explain the costs currently as they stand right now.
Okay, so in 2025, our Part B premiums that everyone pays if they have Part B, whether they're on a Medicare supplement or a Medicare Advantage plan, is $185 a month, is the base premium. Now, there can be, and we've talked about these before, IRMAs, income-related monthly adjustment amounts, that depending on your income, those can go up tremendously. And the thresholds for that for an individual is $106,000 this year. For a couple, it's $212,000. So once they start, IRMA started about a 40% bump on your Part B premiums, and there's an IRMA on your Part D, your prescription drugs too, that a lot of people. So these are things that are shocking to people when they first learn about it. It's something that we discuss, especially as we're going through planning and someone is coming up either on retirement or age 65 and they're planning to get on Medicare. We've got the numbers in front of us. We know what they're going to be getting. The problem is they're going to get a letter from Social Security saying, okay, here's your Medicare premiums. They're the base, $185, but about a week later, you're going to get another letter if you're so fortunate to have made enough money that you get an IRMA letter telling you this is what your real premium is. And it can be up to over 3 times as much as the base.
Yes, and a lot of times it shocks folks if they have never had someone sit down and show this to them and do the proper planning, also because there's a 2-year look back.
That's right.
So let's explain that again, because I know that this can trip a lot of people up.
Yeah, so if we're in year 2025, we're looking back to the modified adjusted gross income calculation from 2023. So if I'm just simply doing regular old retirement planning and I'm just preparing through, the traditional planning network, maybe I've taken distributions from a 401k plan to pay off a house. A lot of people have those kind of goals, or to buy a second home, or to do other certain things. And so I've boosted my income because, again, let's face it, usually the last years of my working year are my most profitable. That's when I'm going to have the highest amounts that are out there. And doing some of these, ideally positive financial planning things. I'm paying off debt. I'm taking money from the 401k plan. I'm doing these others. I have artificially built my income up to a certain number to where IRMA is going to be applied.
And so again, this has to be paid attention to. I've heard horror stories of folks, maybe selling a home, right? And they had this onslaught of income, and then 2 years later, their Medicare is jacked up and they have no idea what happened.
Right. And if you have an event such as a retirement or loss of income or a death, you can actually apply for a life-changing event to reduce the amount. But you can only do that when those events happen. So if our income continues at a certain level, we're going to have the income-related monthly adjustment amounts. We did have an interesting case. A lot of people don't realize that if you're covered by Federal Blue Cross Blue Shield, you can actually opt out of Part B. And people don't realize it. And we had a couple come in recently, and they were going to have severe IRMAs that came into play. And so it really didn't make sense for them to pick up Part B because they didn't have to have it in order to pay thousands of dollars. Because when you have an income-related Medicare monthly adjustment amount, it's not just for you, it's also for your spouse if you're married. So that doubles the cost.
Right. Yeah. So how do you help your folks avoid triggering IRMA? What are some strategies and things that can be done?
The most common option, again, is just simply having the written income plan in place. pace and having someone to understand this is how this works. And so kind of the idea is if I know what my income needs are, I can begin to plan in advance for how I structure assets into into different taxable situations to where I'm still able to achieve the income that's needed, but do it to where it falls underneath certain income thresholds so that we don't trigger these negative effects. Really, the only way to do that is with advanced planning. It's very difficult to kind of catch something, right
Sure.
here and affect it immediately,
Yep.
which is why this type of planning should start, at least a couple of years before the retirement conversation begins. So often we'll go to even an employer group and have a conversation, and somebody will come up and say, "Hey, I'm turning 65 in 3 years. I'll see you then." And it's like, wait. We can affect change today if we get this process started.
Right.
So that's the other thing I would simply say is, guys, don't wait. Especially if you're in a higher income earning capacity, your need for income is going to continue to move forward. We are creatures of habit. We don't usually drop our income need when we get to retirement. In many cases, it actually increases. So let's start that conversation today.
For sure.
And a lot of people don't realize you work off your modified adjusted gross income when we're looking at these numbers. Modified adjusted gross income takes your AGI and adds back in non-taxable interest that you have on municipal bonds. So things you're not paying taxes in other ways. Don't get it wrong. IRMA is just another tax. It's just another way of taxing people that are in certain income thresholds. And so that's something that people just don't realize. Also, your modified adjusted gross income is before any charitable deductions. So those don't come into play, or mortgage interest deductions. So all of these numbers are before those things, not afterwards. And it's also but Roth distributions don't count towards them. So it's one reason that having dollars in different tax buckets makes sense.
Yes.
And our income planning software that we have actually takes IRMAs into account and factors those in. So if we're doing Roth conversion strategies, we can actually go up against different levels.
Right. Obviously, so much goes into this, and you guys have done such a great job of stating the case for why Medicare planning needs to be part of an overall financial plan. What parting words do you have for our viewers as we wrap up today's conversation?
Well, the one thing I'll say is that Medicare planning is also income planning. It is tax planning.
Yes.
It all fits into all of these areas again. I hope you're beginning to pick up the picture that there's nothing that works in a silo by itself. Anything we affect change in one area is going to affect something else. So sometimes it's the idea, especially when it comes to Medicare planning and tax planning, that maybe we pay some more pain today to reap the benefits for much longer in the future. And that pain we're typically referring to is always taxes in this case. So if you don't know what your situation is going to look like where it comes to the Medicare plan, hey, let's get ahead of this and give us a ring and let's get the process started.
Dale, Mark, thank you so much. Thanks for watching. We love you, Arkansas. We'll see you next time here on Arkansas Money Talk.